And I believe that we need to, first of all, review our progress on the mental health redesign, and then look at what additional things do we need to do to make sure that we're providing the best services. I think one of them is having more psychiatrists. And I think Broadlawns and what they're doing will help that. The University of Iowa, of course, is the other place where we train psychiatrists and doctors, so they can play a key role in helping us.
And what I really want to ask you more about is, you said you're going to review the mental health system in Iowa continuously. How are you going to do that? Who are you going to be working with?
Well, we work with Chuck Palmer in the Department of Human Services, because they have the responsibility to oversee that.
Right.
But then we also want to we want to include advocates that are advocates for people with mental health issues.
So organizations.
Right. Individuals and organizations that have an interest there. We also want to make sure that the medical community and as I said, one of the big concerns is make sure we have adequate psychiatrists and people with the right expertise to provide the services.
And that, I know you mentioned the task force, but how are you going to review, whether closing these mental institutions or the mental health redesign itself? How is that affecting Iowans? Is it a success? Is it a failure?
Well, that's where we're gonna constantly work with the Department of Human Services to
Do you have a
evaluate.
timeline on that at all? Or?
Well, as I said, it's a 4-year phase-in. We're just in the midst of that right now. We passed the law in 2012, so we're in the midst of the phase-in and redesign.
Yeah.
And I tell you, I got a lot of complaints from the counties when we first passed it. I'm hearing very few today.
Okay.
So the counties, I think, have come to the realization this is a better system. And so some of the and let me tell you, in 2012, I was catching all kinds of flack from the counties. But this is kind of typical. People hate change, but then when they see it's a better system and we're going to be able to provide better services, and they're able to contract now to provide more community-based services, then I think they come to the realization. And then all I have to do is look at what Minnesota and Wisconsin and other states have done and how it's worked there. And from what I've heard, it's been quite successful.
Are there any benchmarks you're looking for, anything specifically to say that this is a success?
Well, I guess that's a good question. I don't think we're going to eliminate mental issues, but can we do a better job of serving people? Can we do a better job of helping people to be? I think we need to work with psychiatrists, and we need to have maybe some outside experts come in and review what we're doing, so they can give us an analysis of, well, this is working and this could be made better.
So that's something that's going to happen in the next maybe 2 or so years after
Right. This is something, but I think it's something we need to do on a regular basis.
Right.
So I think.
But no benchmarks as of yet as
not
this and this XYZ.
No, and I think the benchmarks would have to be psychiatrists and people that have medical and mental health expertise to tell us what benchmarks we should use. I don't feel that I have the. I know that Chuck Palmer has significant knowledge in this area, but I think we really need to get probably outside expertise that has these particular to come in and review and give us a report on where we are, and then what adjustments or changes they think need to be made.
And